Great day, people! Today my team made out of myself, Leon Wei,
I'm Farisha.
And I'm Shavika Singh.
represent to you the Journal Club about the title of the article, 2-month follow-up evaluation of cancer awareness workshop, Talk Cancer on cancer awareness, belief and confidence of frontline public health staff and volunteers. Introduce to you the panel of authors from Research Department of Behavioural Science and Health, University College London and the Research UK. They are highly relevant to the study's topic. Their focus on behavioral science, cancer research, intervention designs are likely contribute to the study's methodology, data interpretation, and the implication. The abstract of study assessed the impact of Talk Cancer workshop on healthcare professionals' cancer awareness and confidence. The evaluation employed questionnaires before, after, and 2-month post-processing among 178 participants. The investigation focused on participants' comprehension of cancer and their confidence level in publicly sharing the information, emphasizing the need of continuous learning to sustain awareness of cancer risk factor. For introduction, the paper aims to deliver the importance of training program in overcoming the existing challenges such as poor awareness of cancer risk factor, late-stage diagnosis and low screening participation by presenting the study's data. The intended audience, primarily healthcare professionals and academics focused on the cancer research, may gain insights into how efficiently the training workshop helps to increase the awareness amongst the professionals and enable confident communication of information to the public. The workshop organized underlines existing initiatives like Making Every Contact Count, MECC, used to introduce the impact of the consistent and concise delivery of the information, help to engage in conversation about the cancer screening. The data collection used a structured questionnaires given to the participants 3 times, before workshop, immediately after, and 2-month follow-up. Over a span of 6 months, 200 trainees were recruited for the study, allowing a diverse data set. Comparison were made aimed to show changes immediately after the workshop and how they last for 2 months, offering valuable insights into the workshop long-term effectiveness.
Regarding the result of awareness of screening programs, bowel cancer screening awareness significantly improved from T0 to T1 and was maintained until T2. Breast and cervical screening awareness remained constantly high across all time points without significant changes. Awareness for oral, skin, and prostate cancers increased significantly from T0 to T2.
Recognized as the #1 killer, both breast and cervical cancer demands continuous attention and critical understanding.
Awareness for oral, skin, and prostate cancers increased significantly from T0 to T2.
Oral cancer, often linked to tobacco and alcohol use, poses a serious threat to oral health and overall well-being. Skin cancer driven by sun exposure is the most common cancer globally. And lastly, prostate cancer, a leading cause of cancer-related deaths in men, highlights the importance of early detection.
Awareness of risk factors. In Table 3, we observe changes in awareness of risk factors. Smoking awareness remained consistently high, while exposure to secondhand smoke showed consistent awareness level at T2. Improved awareness between T0 and T1 with sustained improvement at T2 for sunburn, underarm deodorants, and mobile phone use.
Smoking not only leads to various cancers but also contributes to cardiovascular diseases. Secondhand smoke exposure poses health risks, especially for non-smokers, increasing the chances of respiratory issues and heart disease. Lastly, sunburn, often underestimated, significantly elevates the risk of skin cancer.
When awareness did not persist at T2, it remained significantly higher than at T0 for other risk factors, which are alcohol, insufficient fruit and vegetable intake, excess processed meat intake, excess weight, and age. Moving to the next part, there were significant positive shifts in result of cancer beliefs. Trainees increasingly agreed that early cancer diagnosis enhanced treatability, and there were reduction also in belief of cancer is a death sentence. These positive changes were maintained at T2. Next, the number of trainees finding it hard to talk about cancer significantly decreased between T1 and T2. Additionally, the belief that nothing can reduce cancer risk remained unchanged at T1 but decreased significantly at T2. C. These are the result of confidence in discussing cancer from 200 respondents. At T1, there was a significant boost in confidence across all cancer-related topics maintained at T2, except for NHS cancer screening programs. But notably, confidence in discussing cancer screening programs are increased significantly at T2 compared to T0. The result of application of training among the respondents, only 86% of respondents applied their learning in their current role, while others 14% had not applied their learning at all. Among them, 32% applied their learning a lot, 25% somewhat, and 29% a little. 105 respondents reported having more conversations about cancer since training, with 66.5% having a little more and 22.5% having much more. And the other 38.8% had a similar number of conversations about cancer. Only 2.3% of trainees reported having fewer conversations about cancer.
Hi everyone, so my name is Shavika Singh. So I'm going to discuss about the discussions of this research. So firstly, the studies highlights about the positive impacts of the training programs, which is the top cancers among the healthcare professionals and their beliefs about the cancers and the confidence in discussing it to the public. But why is this research is focusing on the healthcare professionals, and why is it this research is focusing on other people such as the other staffs? Because one of the reasons is the studies notes that there is a low awareness of the cancer risk factors amongst the healthcare professionals in the UK. So by targeting these groups, it can improve and increase the awareness of the cancer risk factors that in the populations that can make a big impact on the public health outcomes. Alright, so I'm going to continue with the discussions of the research. So these programs was largely maintained in 2 months. So within the 2 months, it demonstrates that the program itself has successfully addressed it and positively influenced the participants' belief about the cancers between the actual and medical causes of the cancers. However, the study contributes significantly to the limited evidence based on the cancer awareness amongst the frontline health in the UK itself, because one of the absence of the control group. So it's very difficult to observe the effect solely to the attendance at the top cancer, because it is possible that the awareness can be more people to join if there is a study period or a cancer campaigns during the studies. If not, there is a less attendance during the top cancer itself. Next, further research should be considered measuring the longer term impacts, such as attending to the 12 months of follow-up rather than just 2 months of the program itself, because it's to provide a more comprehensive understanding of the effects of the cancer awareness of the trainings among the public and the participants. Not just that, the change in data collection method from the papers-based questionnaires to the telephone surveys at the 2 months follow-ups introduced variations of social response bias, because some of physical access that we can do to the participants only can make on paper-based questionnaires. However, telephone surveys can increase the participants' involvement rather than paper-based questionnaire, because of the some challenges that we need to be considered, such as times or places that we need to interview the participant.
Strength of this cancer awareness training workshop called Talk Cancer are a longitudinal approach It provides a comprehensive understanding of the effectiveness of the workshop over time. This allows for the assessment of both immediate and sustained impacts on cancer awareness. Secondly, robust and holistic positive impact of the Talk Cancer Training Workshop is highlighting its efficiency in fostering heightened awareness, confidence, and practical application of cancer-related discussions among the participants.
Hi guys, it's me again. So I'm gonna explain about the weakness of this research. So firstly, is the absence of the control group. So if there's absence of control group, it will less likely to see the effects and the results of the awareness itself, as we can see the comparisons and the changes of the findings. And second is the short 2 months of follow-up periods. So if there is short periods of the findings, so we are most likely we can really see how the participants to be more understand about the effects of the cancer awareness of the training. And then third is the non-random approach. So this means that these follow-up studies was not randomly of selection of the participants. So only selected participant is chosen based on the preference and the criteria. So it make it less likely to have a participant, because it's hard to find the participants that based on the criteria itself. And then lastly is the shift from the paper-based questionnaires to the telephone survey. So it will introduce potential variance in social response bias. So it will leading to the results that may not accurately represent for the entire population.
With that, we have come to the end of our discussion on this journal club. Thank you for your attention, and kindly check out the link if you are interested to read more about this article.